blood clot. Now his friends and family want to educate the general public about blood clot warning signs and how they can seek treatment. Cambi is with them now.
Yes, and obviously everyone knows Patrick, a dear friend of mine, and I will never forget that day when I saw you after John had passed away. It was terrible and so unexpected. He was only 37 years old.
That's right.
So let's first talk about what happened.
Well, it's the call that nobody wants to get, Cambi, and frankly, this September it'll be 2 years. And it was so shocking and so sudden that someone who was so full of life and so vivacious was suddenly taken from us. And we didn't know why, and we didn't know how, and we sort of had no answers at the time.
Right.
And post-autopsy, when we heard about what actually caused his death, we thought, blood clots, really? Like, how does that happen? You know? And what does that even mean?
And so, Peggy, you've done a lot of research. You're his mother-in-law.
Yes, I am.
And so you did a lot of research on this because not a lot of stuff is known about this. And obviously, we now know a lot more because after John passed, you kind of read up on everything. But what would you want people to know about this?
Well, first of all, only less than 1 out of 4 people even know anything about the signs and symptoms of blood clots.
What are those?
Well, first of all, I think it's important for people to understand some stats so they really grasp how difficult this is for our country. In the United States, 1 million people will end up with a blood clot. Out of the 1 million, 400,000 will die from that blood clot. So that's really high stats. It's like 1 person every 6 minutes.
Yeah, and so what are some of the symptoms of that? What should people be looking for?
Well, things that people want to know first is what is a deep vein thrombosis? So that's important that you understand what it is. It occurs when there's a blood clot in 1 or more veins, and usually it's in the leg, that it becomes like this blood clot, and it can become ballooned. And then when that blood clot actually releases from that vein, it will go up to the lungs, and it can cause, it will damage the lungs.
Because it's sending too much blood.
Right.
Yeah, it's clots that actually clog up the different veins that lead to the lung.
And there can be soreness, there can be fatigue, there can be sort of some telltale signs, right, when people identify these blood clots that you might not assume are a blood clot. And that was sort of one of the things with John. You know, it's typically assumed that it's older in age, but it's not.
Yeah.
It can affect anybody.
And I remember we had talked about how he had complained about having vertigo just days before that, and that really could have been something that maybe if he would have gone to the doctor, they could have found.
So some of the signs and symptoms, could be the swelling of the affected leg. It could be pain in the leg, discoloration of the leg.
Okay, now eventually you guys want to do a run next year.
Yes, we do.
And but where do you want people to go right now to be able to get more information?
We want you to go to get familiar with all the signs and symptoms and the preventive measures that you can take and what puts you at risk. You need to know your risk factors. So go to www.bloodclot.
Stop the clot.
That's it.
StopTheClot.com.
Yes.
Okay.
StopTheClot.com.
All right. And
StopTheClot.com.
Through you guys, what you guys are doing, hopefully this doesn't happen to anybody else, but also John's memory living on with all of this.
Right. Exactly.
So we'll be right back after the break.
Thank you.